My name is Dr. Anthony Caifa. I do the veterinary dentistry at North Coast Veterinary Specialists and Referral Centre in Sippy Downs. I'm going to discuss a case today. This is a case of Tyco, a 34 kilogram male neutered 6-year-old German Shepherd dog. Tyco presented to emergency after having an altercation with an excavator. So unfortunately Tyco jumped into the hole that the excavator was digging as the excavator was coming down, and the excavator hit Tyco on the right side of his head, which caused a depressed fracture of his maxilla. So from here across to the hard palate and then up into the frontal bone and then across the lacrimal bone here. So basically this part of his skull, his maxilla, collapsed inwards. So Tyco was presented to me for surgery for this depressed fracture of the maxilla, and we had to think up of a different approach to repairing this fracture. The reason why is because of the depressed fracture, it had pushed his upper maxillary teeth onto the lingual side or the medial side of the lower teeth, and so he had basically a malocclusion as well as a jaw fracture. Also, this tooth here, tooth 104, the right maxillary canine, was also laterally luxated, so it was actually pulled out to the side. So what we decided to do is to try to place a pin across the fracture to support the maxillary fracture and get things back into alignment. Now this approach has, from what I can recollect, has never been written up or discussed in journals, in peer-reviewed journals. So with this maxillary jaw fracture, we decided to use a new novel approach to repairing this fracture. First of all, we had to get the fracture back into normal alignment. So it was a depressed fracture, so we used a large Gelpie across the maxillary premolar 4 teeth in this area here to basically expand the fracture, to expand the maxilla back into its normal position. Now it did take actually 2 Gelpie forceps to be able to do that, so we basically used them to pull the maxilla, the fracture, back into normal alignment. After we did that, we then placed a pin guide. I raised a flap over both premolar 4s, the maxillary premolar 4s, and I basically was trying to aim a pin from between the mesial and distal roots of premolar 4, aim that pin to direct it through the nasal cavity. It went through the voma, the midline here, and across to the other side and exit at the same point on the other side. So with that pin, that would hold the fracture in its correct position and allow the fracture to heal. So we use a pin guide. So this is a pin guide, and a pin guide basically allows us to place a pin on one side and direct it so it will come exit at the same point on the other side. So the pin guide is placed across the maxilla in this sort of area here, in line between the mesial and distal roots of the premolar, maxillary premolar 4, and then we place the pin in, and with a power drill, we basically get the pin to drill through the cortical plate of the maxilla on one side and then the cortical plate of the maxilla on the other side. So the pin will exit in this area here. We raised a flap on this side, so the pin would exit here, and then it's just a matter of releasing the Gelpies. So the Gelpies were there holding everything in place, releasing the Gelpies and seeing if the pin, the Steinmann pin, and it's quite a large Steinmann pin here, would hold the fracture in its correct alignment, which it did. And so then it was just a quick matter of cutting the pin short, burying it under the mucosal flap that we'd raised here and on both sides, having enough coming out one end to allow us to retrieved the pin. Normally this would stay in for around 6 weeks, and so we would take the pin out at about 6 weeks post-fracture repair, and we would take pre-op radiographs to make certain the fracture had healed. With the luxation injury of the tooth 104, the maxillary right canine tooth, we actually did a figure of 8 wiring and bonded it to the other canine to hold the luxated tooth in its correct position. So we did that as well at the same time as placing the pin. And normally we would do root canal treatment on that tooth at the time of pin removal. So luckily for Tyco, the pin removal went all fine. The radiographs of this canine tooth looked healthy, so we did a CT scan right at the start of the procedure before we placed the pin, and this had a fracture involving the maxilla but not involving the apex of this tooth. So we felt that the blood supply to this tooth was still vital. So this is a novel approach that we use. I've only used it once before. We need to get in there as soon as the fracture has happened, because we actually are trying to pull the fracture, the depressed fracture back into its normal alignment, and trying to get the occlusion back into its normal position, which we managed to do for Tyco. The owner of Tyco sent me films. The other good thing about this procedure is Tyco can eat. He can eat soft food. He doesn't need an esophagostomy tube in for feeding. And we palpated the pins. They hadn't penetrated through the mucosa, so everything was healthy. Tyco was happy, and we came out with an excellent result for Tyco, which is why we're here.